Welcome, District Union of New Jersey, District Union number 1 of Central New Jersey, family and friends. This is our Candid COVID-19 conversations. I am your pseudo host, Reverend J. Smith, and I'm pleased and privileged to be here this evening with you. We have an exciting presenter or presenters that will be sharing information with regards to the COVID-19 vaccination, the coronavirus, all the questions that perhaps you have been wondering about, have been thinking about, and maybe didn't have the right information or have just been interested in receiving more information about. Tonight is the night that's going to happen. So before we actually get into it, I'm going to ask that we have a quick word of prayer. Heavenly Father, I thank you. I praise you for this day, this time, this opportunity that you've given us to gather virtually, Father, to have this much needed discussion. I pray, God, that your spirit would be with us, that you would speak to our hearts and our minds, that we would open ourselves up to hear and to listen, that you would inform us, God, and give us direction. That's what your spirit does. It teaches us and helps and guides us in our ways. So I pray, Father, that you would empower and equip the presenters tonight, give them wisdom and clarity of speech and thought, God. And may we, your people, God, again, be edified and strengthened in this endeavor. I thank you and I praise you. It's in Jesus' name we pray. Amen.
Amen.
Amen. Again, so excited and privileged to be among you tonight. And so I'm just going to roll right into it. Our district union of Central New Jersey, number 1 member, a proud member of the Hope Church, the House of Prayer and Evangelism, is our brother Nashon Hornsby. Nashon has been a member of Hope Church for lots of years. He's served in so many different capacities, primarily as a servant. I mean, he is one who serves the Lord with his whole heart. Nashon is that utility person that whatever you ask him to do, he is more than willing to do it. And he just has a heart for serving people. Now I'm going to look at the note, Nashon, because I don't always get it right. Nashon is currently the Assistant Commissioner for the Division of Community Health Services. He oversees the Community Health and Wellness, which is Chronic Disease Control and Prevention Services Unit. He is a man of many talents. He is an attorney licensed in the state of New Jersey. He has done various works for the state and really has a focus on community health and community resources. And so he is one that I believe God has positioned in this time to help us with this topic specifically. And again, I thank you, Nashon, for your willingness to come and to share with us. So on behalf of our president of the district, Pastor Eiley E. Bright, and all of the pastors, I say thank you and welcome. And I'm going to get out the way and turn it over to you to take us forward into this conversation.
Well, Pastor-elect Jay, I want to thank you for inviting me, and for Reverend Cole, along with Reverend Smith, that have asked for me to come and present to District Union number 1. As a member of the district, I know that we are a collective of churches that come together on many topics that are relevant at the moment. And when asked to have this discussion, I thought it was wonderful. I'd like to introduce 2 of my colleagues who have graciously made themselves available for this discussion tonight, and to share with you what the Department of Health, your Department of Health, is doing to ensure that communities, and in particular vulnerable communities, receive vaccinations during this pandemic. First, I'd like to introduce Ms. Thalia Sergiu, who is the Deputy Chief of Staff for the New Jersey Department of Health. And she will tell you a little bit about her role as it pertains to the COVID response that we have been engaged in up to this point. Thalia?
Thanks, Nathan. Thanks for having me. Hi, everybody. Good evening. As Nation said, my name is Thalia Sergio. I'm the Deputy Chief of Staff here at the New Jersey Department of Health. And in my day job, I work on strategic planning and different initiatives for the Office of the Commissioner. My COVID world job has been to lead our statewide contact tracing program. So, in that, we have we've gotten up from 300 to 3,500 contact tracers on the ground. We launched a statewide contact tracing program, and we launched our COVID Alert NJ app to try to help us fill some gaps because folks weren't really answering the phone for our contact tracers. So I have now stepped into the world of vaccines alongside Nation and some of our other colleagues, and we are trying desperately to do everything we can to get every person in the state who would like a vaccine to get one to them. So thanks for having me. And when the time comes, I'll be telling you a little bit more about our vaccine program.
Excellent. Thank you so much, Delia. And next, I'd like to introduce a gentleman who actually helps me. He is a phenomenal manager within the Office of Primary Care and Rural Health, and he works around the clock on weekends, holidays, sick days. Damon Coslow is my manager in the Office of Primary Care and Rural Health. And please describe the work that you do, that you were actually hired to do, and then talk about what you've been doing relative to COVID during this pandemic season that we're in.
Thank you, Nation. I appreciate that. And, sick days, vacation days, what you forgot to mention was during house closings too.
Yes.
Thalia made it pretty clear, right? We all seem to have these day jobs and then COVID jobs on top of them. So my day job, I'm the manager for the Office of Primary Care and Rural Health. So I work very closely with the federal qualified health centers across the state, coordinating claims and programs for individuals who do not have insurance and do not have the ability to pay. So we have a program that ensures that folks that do not have that ability to pay can still receive the appropriate primary care, dental health, and mental health services that they need, and allow them to have access to care on demand. And I'm not going to bore you with all the other duties that I do during my day job. My COVID world, when this all started, I was tapped to work with setting up testing sites across the state, including a lot of faith-based organizations. We set up indoors, outdoors, just wherever the need was. We set up what we just referred to as pop-up sites, and we ensured that we could bring the testing to the communities, to the individuals that needed the testing. And if time allows, I'm happy to talk a little bit more about that and how we can, connect to do that as well. Because just because we're in the vaccine world now doesn't mean we should not still be getting tested. That's still very critical to continue the testing. Once the vaccine came out a few months ago, I guess somebody realized there was 24 full hours in a day and I didn't need to sleep. So in addition to the testing piece, I'm also overseeing the vaccination piece for the federal qualified health centers and certain special populations like senior high rising and urban communities. So basically, I just help coordinate vaccinations, allocations to the federal qualified health centers, as well as setting up kind of matching providers to communities to bring the vaccinations to the individuals who need the most. And I definitely appreciate the opportunity to be with all of you tonight.
So what we are going to do this evening, just the rules of engagement, so that we understand what our purpose is this evening, is to share with you, but also more than that, to be here to answer questions, to address concerns that people may have regarding the vaccines and around testing and all that we're doing in the state, so that we can alleviate any mystery that may be out there, any lack of understanding of how things are being done by the state, what the options are relative to accessing vaccines, we want to make sure that we share with you all of the answers to questions that you may have, and where you may not have felt like you had the right person to talk with to get those answers. And that's why we're glad that this is described as a candid COVID-19 conversation, because it is meant to be just that. We are your servants as public health employees. And on behalf of our Commissioner, Judy Persicelli, who has done a number of town halls across the state with various groups, we wanted to make sure that we met with this particular group, predominantly because we are talking amongst a group of individuals who fall into the vulnerable categories that we are concerned about. Namely, we are not seeing enough minorities, ethnic and racial minorities, accessing vaccines. And in particular, we're still seeing more than we would like to see disproportionately transmitting the virus, and unfortunately, a great number succumbing, being hospitalized and or succumbing to the virus. And so with that, I just want to make sure that you understand that this is interactive. We are not intending to lecture you. We do not pretend to know every concern that may be out there. And so we want to make sure that we hear from you throughout the time that we have this evening, and that we are able to respond to you. Know that we will be checking the comments throughout the time this evening. And if you have something that comes up, you don't have to wait for a special time to put up your comment. We'll be watching those comments, and we'll be making sure to respond to them as quickly as we can. And where we don't have an immediate answer, we will make sure to get an answer to this group as a follow-up. That is our promise to you. And so with that, I want to make sure that my colleague, Ms. Sergiu, has an opportunity to share with you from a slide deck that was put together to present to you what we're doing here in New Jersey and how we have been able to ensure that there's access to vaccines and growing access week to week. We will assure you that while we recognize that in the beginning there were, and still currently there are too few doses than the demand, we are getting to a place where things are moving much better. We've had increased numbers of doses that have been coming to New Jersey, and we have increased the avenues to get those doses, most notably starting to incorporate faith-based organizations, some of the federally qualified health centers, other community-based organizations that are touching those vulnerable populations in the state. And so with that, I'm going to hand off to my colleague, Thalia, and ask her to present the slide deck. And again, as questions come up, we will field those questions, and we will have a tremendous amount of time, even after those slides, to be here for question and answer as well. So let's see about trying to share these. Now, Thalia, are you sharing your screen or am I? Just to be clear.
I'm sharing. Can you see my slides?
Not yet. It's like a two-step process. There we go.
Oh,
there we go. Got it.
Wonderful. All right, so let's get vaccinated. As Nation shared, we have been on a mission to get vaccines out to everyone that we can. There's a high demand, and as he shared, not as much supply as we would like to go around, but we're getting there. We have much stronger support from our federal partners, and we are getting additional doses out as best we can. So I want to just talk a little bit about what is going on in the world of vaccines and give y'all an opportunity, as Nation said, to ask any questions. Feel free to stop me, throw something into the chat, and Nation and Damon, if you guys are monitoring, give me the finger, the church finger, or just holler out where somebody if somebody has a question. Don't be shy, please.
One did come in just at the very beginning, and the question is, how can we encourage our community to get the vaccine? Because even healthcare professionals that this individual works with are hesitant.
Yes, that is something that we are seeing, particularly in the Black and Latino communities. And I think, what our effort has been is to get as much accurate information out to people as possible. We have to recognize, I think, that we're all going to have a different vaccine journey. Some people are going to be like, yep, put it in my arm. It's ready. Let's go. I'm tired of this. And other people are going to be a little bit more hesitant, and that's okay. But what we want to do is make sure that people are making informed, educated decisions based on scientific evidence and not some random thing they saw on Facebook or Twitter or Instagram somewhere, or a rumor that they heard somewhere, because that's just not what we want. People might decide, no thanks, this vaccine is not for me. But if they make that decision, we need it to be based off of factual information and not a fear that's not based in fact. So I think what we've been doing to try to encourage people to not be so hesitant is just to give them as much information as we can. People are a little bit less hesitant when they have more information, whereas if they only have a little bit of details, or they've only heard a thing here and there, there might be a little bit more fear there. So we're going with information, hopefully is leading to comfort and less hesitancy. So I guess we'll ask that you all do the same thing. Towards the end of the presentation, I have some samples of some of the materials that we have. We have a toolkit that we'll be able to share, because we also respect and recognize the fact that as a government administration, we are not everybody's trusted confidant and favorite source of information. And this is why we need folks in the community like you all, who can take this information and share it with your neighbors, share it with your church brothers and sisters, share it with your family members. And if you hear them saying something that's not true, call them out. Say, that's not what's on the CDC website, ma'am. And just make sure that people are sharing the right information. So I think that if we keep doing that, eventually we'll get to a better place. Now, y'all see I'm chatty, so, keep pushing me along if needs be.
That's all good. I can also, while you're going to proceed with this slide deck, one thing that I'll say that I've seen personally is that some people were looking to me and asking me what my experience was, whether I was going to get the vaccine. And I shared with people my journey. I rarely use social media, but on this topic, I actually posted to Facebook, look at me. And I shared with people my experience. I happened to have taken the Moderna vaccine. I had both doses. And even though it's a personal experience that each person goes through, my experience was exceptional. I had just light soreness in the left arm where I had my injection. For both injections for a day and a half. No other side effects. I had nothing else go on with me. And I also share with people what close family members of mine have experienced that did have slight side effects, who had no problem with me sharing. I, of course, asked those family members and they said, sure. So, they shared with me, one had a headache for a day after their dose, but nothing more serious. And another family member, after the second dose of Pfizer, had indicated that she felt for about a half hour one morning, felt a little dizzy, and then nothing beyond that. So, we talk about a lot of things in the church. And we share our experiences around a lot of topics. This is yet another one of these topics that we should be open and transparent and share with one another. And so with that, I'm going to turn it back over to Thalia.
Thank you, Nation. Yes, that is very, very important. We got to demystify this a little bit. It's not as scary as it seems, and sometimes folks just need to hear a personal experience. So thank you for sharing that. So back to the slides. Just, I like to start off with making sure that we are level setting, that the most critical piece of our message is that the COVID-19 vaccines are safe, effective, and they are free. We have heard some horror stories of folks saying, oh, so-and-so said they're going to charge me and I'll get it faster, or they're giving me something else. Please, please, please know that if anybody hears anything about somebody charging them, that's not real, and we need to try to help keep each other safe. So we're going to talk a little bit about, background, making sure that we're all in the same place. What is COVID? Let's talk about the vaccines, how you can help your community, how to get a vaccine in New Jersey, and where to learn more if you have some more detailed questions that we might not cover. So COVID-19, as we are all now, getting to be our own little epidemiologists and scientists here, is a disease caused by a virus called SARS-CoV-2. As we've all seen, it can be very serious and it can have lasting effects. It is extremely transmissible. It is spread easily with close contact between people. And mostly it happens when people are breathing, talking, coughing, or sneezing, and they might produce droplets that other people inhale. So the vaccines are important because they are currently our only line of defense to protect ourselves and to protect others. They help by building up your natural defenses in your body and trying to keep you from getting sick. The more people get vaccinated, the less sickness will be in our communities. And you've all probably heard something called herd immunity. That's what that refers to. So I'm sure you've heard all of our goal in the state of New Jersey is to get at least 70% of eligible residents vaccinated. And that's why. So we get a lot of questions about asking us whether or not the vaccines are safe. Yes. Yes, yes. So far, the FDA has approved through emergency use authorization 3 vaccines: Pfizer, Moderna, and Johnson & Johnson. You cannot get COVID-19 from any of these authorized vaccines because they do not contain any live virus. The vaccines do not, under any circumstances, alter your DNA or cause any type of infertility. Before getting the vaccine, we do recommend that you talk to your doctor, particularly if you have a severe allergy, if you've had any serious reactions to vaccines in the past, or if you're breastfeeding, pregnant, or plan to become pregnant anytime in the near future. So a lot of people also ask, how were the vaccines developed so quickly? And the truth of the matter is it didn't happen as quickly as we think. So the first important thing to notice is in regular vaccine development, the phases of clinical trials, they happen one after the other. However, because of how important and how crazy the pandemic has been across the globe, testing of the vaccine, the phases were overlapped. And manufacturing began early so that the vaccines could be made and authorized as soon as possible to get them out as quickly as possible. Sometimes people will ask us, why do I need 2 doses? You need 2 doses of the Pfizer and Moderna vaccines for the maximum protection. It's important to note also that your second dose should be the same brand as your first dose. So if you start off with Pfizer, you can't jump ship and decide to get Moderna for the second dose. The vaccine's doses are spread out about 3 weeks apart for the Pfizer vaccine and 4 weeks apart for the Moderna vaccine. After you're vaccinated, though, we still recommend from the CDC that you have to continue wearing a mask and practicing physical distancing. And that's important because even if you're vaccinated, you can still be a carrier. Even if you're not sick and you could get other people sick who are not vaccinated. And that's important to note because we're moving through this in these eligibility phases. So you might be eligible, but somebody else in your family or your household or the community, they might not be eligible to be vaccinated yet. So it's still important for us to continue masking and social distancing just to make sure that everybody's protected. Now, some vaccines don't require 2 doses. That's the Johnson & Johnson. You'll hear a little bit more about that, and that's something that's newly approved by the FDA. We don't recommend that you wait for any particular type of vaccine. And in New Jersey, you can't really select what kind you want to, just because it depends on where you go to make your appointment to get a vaccine. And that happens because only certain facilities can handle the different storage requirements for the vaccines. Like, for example, for the Pfizer vaccine, it requires a super duper freezer to keep the vaccine extremely cold. And not all facilities have that capability. So that's why not all of the facilities that you'll try to make an appointment at will have an option. They'll just have the one that they have the qualifications to store. So what do the vaccines do? They help our bodies. They defend against germs, and they mostly protect us against viruses and bacteria that might make us sick. They help by making our immune system fight off the germs by teaching it to make antibodies. So the side effects of the COVID-19, and Nashon mentioned a few of them, but the most common includes pain at your injection site. So where you get the vaccine, the needle in your arm, most people experience pain there. My mom, she got her vaccine, her first dose a few weeks ago, and she said it kind of felt like when she got a tetanus shot. It hurt pretty badly in her arm, but thankfully that was the only side effect that she had. Some other people, though, have stated that they've felt a fever, chills, tiredness, or headache. And as Nashon mentioned, some folks have also reported dizziness. The side effects from your vaccine usually go away in a few days. Again, anecdotally, I've heard from my own family members and folks who have been vaccinated that usually within a half a day to a day, they've noticed that the side effects start to subside. But everybody's body is different, and your experience might be a little bit different. So just make sure that you monitor it. And if redness or tenderness does not start to go away, or your side effects don't start to go away, that's the time when you need to call your doctor and make sure that nothing else is going on. So again, we have to have a reminder, how do we help prevent spreading COVID-19? Of course, as I said, we want everybody to continue wearing our masks. In New Jersey, it is still required that you wear your mask out in public spaces. Try to stay at least 6 feet, which is about 2 arms length. Probably not my arms because I'm pretty petite, but an average person's arm's length from each other. Avoid crowds, wash your hands often, and when you're eligible, of course, go and get vaccinated.
So there was one question in the comment about whether a person should be vaccinated if they have already had COVID-19 and recovered. I know that's on your slides, but I just wanted to get to their comment.
Yes, and I believe it's been there in a few, but I think that the current CDC guidance is you only have that protection after your recovery for about 90 days. So if you're past that period, then you should still get vaccinated.
Thank you.
Mm-hmm. So there are a lot of ways to get vaccinated or to find an appointment for a vaccine in New Jersey. Now, I think the most critical piece is learning first whether you are eligible for a vaccine. And we'll talk a little bit about the eligibility requirements in a couple of slides. But Also want to lead folks to our info hub, our COVID-19 info hub. I hope that all of you are familiar with it already. Lots and lots of information here. But at the COVID-19 info hub on the vaccine page, there are links there for you to find out if you're eligible. We are currently in phase 1B of our eligibility of our rollout. And that includes a number of different personnel or categories of individuals who are eligible to get vaccinated. Another quick way to do it is to register with our New Jersey vaccine scheduling system. We like acronyms in the government, so we call it NJVSS. Once you register there, it'll tell you what phase you qualify under and whether or not you're eligible. And if you're eligible, when appointments open up in your area, it'll send you an email to let you know that you can call or go online to reserve an appointment. Other ways that you can try to get an appointment are booking directly with vaccine locations. So there's some hospitals, your CVS's, your Rite Aids and Walgreens. They are not using our state system because they have their own platforms. So for those, you would have to go directly to their site and try to make an appointment there. Another way for you to try to get an appointment is to call our vaccine call center. The call center number is 855-568-0545. We have operators standing by who can help you with scheduling. They can also help you with registering if you or somebody that you know does not have access to a computer. And they can just answer general questions. A lot of folks have some questions about the vaccine. So that's why our call center is so important. So to make an appointment on NJVSS, you're required to submit some personal information, including your name, your address, your gender, your race, ethnicity, and your birthday. And it'll also ask you for some medical screening and occupational information, as those are the categories that'll help us determine if and when you are eligible. Now, what should you bring to your vaccine appointment? I think the most important thing is you'll be given, when you make your appointment, particularly if you make it through NJVSS, you will be given something to confirm your appointment. It might be a confirmation email. It could be a QR code, like one of those little barcode scan things. Or you might just be asked to provide your name and your date of birth. You do not need proof of insurance or documentation to get the vaccine. If you are deaf or hard of hearing, you may wish to bring a communication checklist with you just to make sure that communication is as clear as possible and you can be helped by the folks who are at your site. Now, you'll also receive a card at the vaccination site so you know what type of vaccine you got. And if it's one of the two that require a second dose, that card will also have the date on it for which you should be coming back to get your second dose. Now, most sites will make the appointment for you before you leave, but some of them might send you the appointment reminder via email or text or give you a call, however it is that they interacted with you for your first appointment. So after you get your first dose, again, very important to make your second dose appointment. And some of them, like I said, you'll have it with you right as you walk out the door. Others, they'll probably contact you a little bit later. When you go, you should bring that card with you because that's going to be your record of vaccination. Then they're going to record on there that you did, in fact, get your second dose. You should know that it takes time for your body to build that protection, that immunity. So you're not fully protected until about 2 weeks after your second shot. So don't get your second dose and go crazy. Remember to continue wearing your mask and keep physically distancing from others. So where can you get more information? As I said, you can call the vaccine call center. They have many languages available, including Spanish. And you can also visit our COVID-19 Info Hub. There's information on the Info Hub, not just about vaccines, but if you still have any questions about getting tested, if you have questions about social supports, if you have questions about anything related to COVID-19, you'll be able to find it on the COVID Hub. You can also text NJCOVID to 898-211, and you'll receive text information so that you can stay informed via text message from our partners at 211.
So there are a couple of comments here, questions that came in, and Jay and I see this quite a bit when we're out working with the federal qualified health centers. The first comes from First Lady-elect Smith from Hope Church, and she asks whether undocumented individuals are able to get the vaccine, and is anything reported or shared with ICE, Immigration and Customs Enforcement?
That is a wonderful question. Thank you, Ms. Smith. No, there's nothing is shared with ICE. Undocumented folks are more than welcome to come and get vaccinated, make an appointment. We do not charge. There's nobody turned away. The only thing that folks will usually do is you have to verify your identity, but it doesn't have to be a state or government issued ID. We've seen folks show up to some of our community centers with a library card, honestly. We are erring on the side of inclusion. We want to vaccinate as many people as possible. And so we're trying not to put up unnecessary barriers. And that includes for our undocumented residents as well.
And just for clarification, the information that we're gathering when we want to know identity is just to make sure that we are able to track so that that person, number one, gets their card that says that they had their first dose, they can get their second dose. Secondarily is that we have a national database that we're feeding into to show how well we're doing on vaccinating the residents, not just citizens, but the residents of the United States overall, to help us to measure when we are approaching herd immunity. The only way we can do that is if we have an accurate count of heads of people that have been vaccinated. And so we don't care about their immigration status. We just care that they've been vaccinated. And also now I see that First Lady Bright adds her question regarding whether there are particular questions that we've been receiving regarding apprehensions that people have. And part of it is the one that was just raised about, immigration status. Some people have raised questions about the speed with which the vaccine was created. Other questions have been about whether some of the weird notions that the vaccine is going to put a chip in your arm, or that there's going to be a DNA transformation, that there's going to be, that there's something lethal in the vaccine that is intended to harm certain groups of people. And all of those are myths that are false. We want to state it again. There's no truth to those myths. But we also know that people do have these concerns. And so we want to make sure that we hear them and that we share the truth from individuals, that hopefully individuals have a sense of trust in knowing that we're of the community. And so just wanted to make sure we respond to that. Next question is there something that we have to repeat, like the flu vaccine? Is it a one-time and done?
So the honest answer to that is we don't know yet. I have to keep reminding folks that COVID just burst on the scene a year ago. And unlike many of the viruses that we are, all unfortunately all too familiar with, this is not one of those. So the CDC, the World Health Organization, they have made it very clear that we are still learning, and we're going to have to see what happens once we get to those high rates of vaccination. and watch what happens, and then adjust accordingly, as we've had to do numerous times throughout the year as we learn more and more about how COVID-19 operates. And I know that's a terrifying thing, because we are not used to seeing clinical work or science and public health play out in front of us. Usually, by the time we hear about things, there are answers and we can be confident in them. So, but I feel like it's important to be transparent that the answer is we don't know yet. Okay. Thanks, Nation, for keeping me honest, because I can't see the chat when I'm going through.
No problem.
Okay, so I think importantly, a lot of you have asked, a lot of folks have asked already, how can we help? And like I said, we want to spread the word. We want folks to understand what the risks are, what the benefits are, how the process works. How do you get an appointment? We don't want anyone to not have the information that they need to make an informed decision for themselves. So please help us spread the word. We can be followed on Instagram, on Twitter, on Facebook, on LinkedIn. We are sharing toolkits and information with folks like you all in churches and community centers, at food pantries, wherever we can. We're trying to get information, and we can share this deck with you all. And Nation, I'll get you the toolkit from Amanda so that you can share that too. There are posters. You can print them, whatever size that you want them to be, hang them up all over the place. I know I personally, whenever we get some kind of new graphic, I send it to my pastor and I'm like, can you make this your Zoom background for Sunday Zoom church? Or I ask her to put it in the weekly newsletter that she sends out. So any way that you can get information to people, you all know better than we do. Like, we've got our channels, but everybody's not on social media. So it's important to spread the word however you think folks are gonna accept it and receive it. So I want to talk a little bit about, now that we kind of talked about the vaccine itself, I want to talk a little bit about our program and how we're trying to roll this out and what we're seeing so far and where we might be experiencing some challenges. So overall, the aims of our program are to provide equitable access to all who live, work, and/or are educated in the state of New Jersey. We want to achieve community protection, assuming that the vaccine effectiveness, availability, and uptake are all there. And we want to build sustainable trust in COVID-19 and other vaccines. So to date, we have administered over 3 million doses of vaccine. And you can see on the left the breakdown between how many Pfizer doses, how many Moderna doses, and how many Johnson & Johnson doses. To date, we've had an 89% second dose completion rate. And that's really important because that means 89% of the people who have been vaccinated so far are fully vaccinated. We are still chasing after those stragglers, but 89% is pretty good. We have 650 plus vaccination sites across New Jersey, and that includes 50 FQHCs, 6 of our state-supported mega sites, 10 of our FEMA-supported community-based vaccination sites, and over 1,200 long-term care facilities who are being served through the federal LTC pharmacy partnership. We've had 3.1 million people register in NJVSS. We have been trying desperately to do community outreach and spread the word on meetings such as this. To date, we've had over 100 stakeholder calls just about vaccines, which have reached 11,000 people. We've had 1.3 million calls into the call center, and some folks just listen to the message to get the information, but others actually need to talk to a live agent. So of those 1.3 million calls so far, 372,000 have been taken by a live agent. So vaccines have been administered across different demographic groups. And as you can see, our female residents have a slight edge up on our male residents. If for as far as the race ethnicity distribution, you'll see the largest portion of the race ethnicity distribution is to our white residents. For our Black and African American, it's about 4.5%. Hispanic Latino, about 6.5%. Our Asian community, about 7%, and those of other races, 11%. And there's also about 11% of the race ethnicity that are unknown. So sometimes folks just decide they don't want to share that information. Now, that means we still have a little ways to go. New Jersey, I believe, is about the state population is 15% Black and a little over 20% Hispanic Latino. So it's really important to us that the distribution of our vaccine doses, the administration, it starts to get closer to mirroring what the distribution of our actual state population is. And that's really important. So this is why we're trying to do stakeholder outreach, get to community groups, to faith-based organizations, and to meet people where they are, get them that information, and let there not be any hesitancy, because a lot of people don't even realize that they're eligible, and some are still just, afraid and don't want to get the vaccine.
There are 3 questions in the comment box. I'll try to go through them. One was about the age for the vaccine to be administered.
16. So I don't want to misspeak, but I believe it's the Moderna. I'll confirm that. I believe it's the Moderna that is 16, approved for 16 and up.
And the second question is whether there's talk of the vaccine being mandated.
Not yet on the state level that I'm aware of. I can't speak for private institutions, healthcare facilities, and entities such as those, but we have not at the state. We're trying to get everybody that wants one a dose, so we haven't really had to do that yet.
And if someone misses their second dose, is there a time frame where it will be ineffective and they need to start over?
So I think, and I can double check and get back to you on this, but I think that the CDC guidelines have been, if we have to us as vaccinators, if we have a no-show, we should keep trying for up to 6 weeks to try to get them back for that second shot. But I can make sure to relay that information to our team and get a confirmed response on that.
Thank you.
I just want to correct the statement there, Thalia.
Please.
It's 16 for Pfizer.
Oh, thank you.
16 for Pfizer, 18 for Moderna and Johnson & Johnson.
Thank you.
Sure.
Look, you got me out here giving the wrong information. Thank you, Damien. Came to my rescue, as usual. Okay, so as of today, let's talk about eligibility. These are all of the individuals eligible to be vaccinated as of today in their current phase. That includes childcare workers, first responders and public safety workers, members of tribal communities, migrant farm workers, paid and unpaid healthcare workers, everyone over 65. Persons experiencing homelessness or living in shelters, and that includes domestic violence shelters. Pre-K to 12 educators and staff. We want to cover everybody who is in the education system, not just the teachers. It's the ladies who are serving lunch to our students. There's the janitors, there are the guidance counselors, folks who are not necessarily the teacher title. They are all eligible.
Bus drivers as well.
Yes. Public and local transportation workers, residents and workers in long-term care and high-risk congregate care facilities, and persons aged 16 to 64 with certain medical conditions. And there's a full list of conditions, but this includes people with diabetes or cardiovascular disease, people who have, I think it's a BMI, a body mass index of 30 plus, smokers, because, they're more susceptible as a respiratory disease. So there's a whole list of those conditions. So folks can know if you are between 16 and 64 years old and you have any of those conditions, you are eligible to get vaccinated and can go and get an appointment. We'll be expanding our eligibility again in a couple of weeks. So beginning Monday, March 29th, frontline essential workers in the following categories are also eligible for vaccination. And that's clergy, elder care and support, elections personnel, food production, agriculture, and food distribution, hospitality, judicial system, medical supply chain, postal and shipping services, social services support staff, and warehouse and logistics. So all of those folks, those essential workers, will be eligible March 29th. So we have some programs designed for outreach to our priority population so that we can reach some individuals with specific needs. And the one I think that a lot of folks have probably heard the most about are our community-based vaccination sites. Here, we provide vaccinators for pop-up sites at faith-based and community-based organizations. And currently, we're doing that in 10 municipalities across the state, and it's with those that have high vulnerability populations. So there are 5 teams from FEMA with about 20 staff each. To date, we've launched 8 of those 10 sites, and they've been in Franklin Township in Somerset, in Trenton, Elizabeth, Patterson, Camden, Jersey City, Orange, and Vineland. And we have another coming in Pleasantville and in Newark. And Nashon can share a little bit more about those because he's headed 2 of those sites up for us. The next is our FQHCs, which I'm going to breeze over because Damon is the expert in that area, but they have also been allocated doses, and there will be directly from the federal government, and there are over 50 sites open in some targeted areas. There's also our federal retail partnership, in which you will see, as I mentioned before, pharmacies such as CVS, Rite Aid, and Walgreens, who are expanding into some of their stores, not all of the stores, but some of them. So there are 227 CVS locations, 75 Rite Aid locations, and 105 Walgreens locations that are currently active. For our Johnson & Johnson target population, so because Johnson & Johnson is temperature neutral, so it doesn't require like the freezing cold refrigeration or freezing that the Pfizer and Moderna vaccines do, it gives us a little bit more flexibility to go out to areas and to serve populations that we can get to a little bit further, and that maybe not necessarily they can come to us or to a site. So some of those doses are going to be allocated for individuals at homeless and domestic violence shelters, for emergency departments where people may show up and they might just need to get a dose, for county and local sites, or from our independent pharmacies, because we want to be able to provide walk-up access in places where everybody might not have a car, or they may not have a computer or a phone or the ability to make an appointment. We have cohorts of migrant farm workers. We have our seniors who live in senior high-rises, and county jail staff and defendants. We're also developing statewide plans for homebound seniors in collaboration with the Department of Human Services. So those are the populations that we think will benefit from the Johnson & Johnson vaccine, again, because it has less restrictions on the temperature storage requirements.
So there are some questions in the comments. One is eligibility the same for private institutions such as hospitals?
Yes, this is our statewide eligibility.
And just a caveat there that hospital employees are that are in person are considered essential, and so those employees within the hospital and many that are linked to the hospital are in that, they were in that phase 1A, and so they would have been eligible. And by the way, any person who was in those earlier eligibility categories, they don't miss the window of opportunity because we've advanced to other eligibility groups. Just to be clear, if we advance as the state advances to different groups, all of those that came before in those earlier groups that may have had some hesitation, that may have been concerned, wanted to wait a little while, they don't miss that opportunity because they waited. I just want it to be very clear to the community that they haven't lost their chance. They can still get that vaccination. They can sign up. Second person asked the question, if you are within 90 days of having tested positive for COVID and you are called for an appointment, will you still be able to schedule a future appointment during that time, or will you need to wait for another rollout phase?
So as Nashon just shared, your eligibility is like, it doesn't expire ever. So once you're part of an eligible group, that eligibility continues going through. I hope I answered that question correctly.
And then the third question that is in queue right now is, do you have the option of taking J&J or Moderna, since the J&J vaccine only requires one shot?
So currently that would mean you just have to pay attention to where you are making your appointment, because most places only have one type of vaccine at this time. That might change in the future when we are allocated more doses from our federal partners. But at this time, you can't really, like, most sites don't just have all three that you can kind of pick off of a menu. It's just whatever the site has. So if you want something in particular, you would have to pay attention to which type of vaccine that site has.
And Damon, do you want to just touch upon, just very briefly, the FQHCs and the federally qualified health centers? I'm sorry, I'm guilty of acronym usage as a public health official as well. Federally qualified health centers, the FQHCs, they've been working with us to reach vulnerable populations and are in many of the communities where our congregants live. And so can you talk just briefly about, some of the options that we know to exist there?
Sure. For the most part, the FQHCs, Federal Qualified Health Centers, they carry Moderna. But some of them are receiving the Johnson & Johnson as well, because we're making arrangements with them to give them that one-dose vaccine so they can go out and target the populations that Thalia just mentioned that are kind of earmarked for hard-to-reach populations that may or may not have a way to actually show up to come for a second dose. So it's just helpful to be able to vaccinate them once and then they're done. So, which is a perfect segue into a comment I wanted to make, is that, your churches, your faith-based organizations, your communities, if you have a group that is sort of struggling to get vaccinated, reach out. I think through this group, you have access to Nashon coordinate with myself and others, and we can try to match a provider to that location and potentially have a provider or a group of providers come on site to vaccinate you as a group and have it planned for a whole day. Can't guarantee that, but we can certainly try and plan for that the best we're able to, given the current resources we have, personnel wise and vaccine wise. But the FQHCs, you may not know them as FQHCs. They don't necessarily label themselves as that. Henry J. Austin is a federally qualified health center. CamCare, Zufall. I don't know all the different areas that everyone is in, but on our Department of Health website, you can actually look up federal qualified health centers to see a list of them. And it might even be a provider that you go to now or just down the street. I mean, a lot of them are, kind of in inner cities that have highly populated areas. And that's sort of the goal behind, or the mission behind, what federally qualified health centers do. Their mission is to serve populations that may not have access to care, may have limited resources, limited or no insurance, and they receive federal funding to ensure they will provide access to care regardless of an individual's ability to pay. And we work with them and other providers to coordinate on-site vaccination, as well as on-site testing. We can send teams of folks to come out and do testing as well. So if your groups are interested in either of those, please reach out. Happy to see if we can make a connection and have a team come in and meet you where your community is to provide the services you need.
One quick note in this regard is that one of the things that I have been totally amazed by always in my journey as a member of the district union is that all of the member churches are also committed to community beyond their congregations. And so we want to encourage you not only to encourage your congregants, but also those other connections that you have to communities that you serve. And so the vulnerable that you may be providing, food to, where you may have, a food bank that you have stood up for years and have provided to the community, they need to be vaccinated as well. And the same information that we're sharing with you about your congregations is also the same information that you should feel free to share with others that you have as an extension of your mission, your spiritual mission, if I may, so that we are ensuring that all of our brothers and sisters are vaccinated. So I think those are the questions thus far, Thalia. We can get back to the slides. I know we have about 10 left, right?
Yes, sir.
Okay.
Okay, so as I mentioned earlier, we recently started vaccinating with Johnson & Johnson. When we started the program back in December with our long-term care facilities, it was just Pfizer, then Moderna rolled out, and Johnson & Johnson, I think it's just, goodness, maybe a week or two that we've started to get that out to the population. Because it's a single dose, as I said, and it doesn't carry some of the temperature storage restrictions as the other two, it's kind of going to be a game changer for us to get to individuals in high risk situations and vulnerable situations across the state. So we have had quite a few engagement and outreach efforts. Hopefully some of you have seen our commercials, billboards, social media posts, videos, and the like all over the place. We're trying to get them out. And if they're not out there, if you're not seeing them, let us know. As Nation shared at the top of this is new. This is a once in a lifetime pandemic. The commissioner reminds us of that often when we kind of, sometimes kick ourselves like, oh, we should have done this and we could have done that. We are not purporting to know everything. So if you all have suggestions, if you have ideas, if you have feedback, if you have input, please always feel free to send them our way. We value that. And we are not always on the ground, so we don't always hear the feedback. And if we have a message going out and it's not striking the right tone, we want to know about that so that we can correct it. But we have been engaging with physicians of color, with community organizers of color, with faith-based leaders of color, because we realized how hesitant our own communities are and how important it is for us to get them vaccinated, since we bore the brunt of the COVID-19 burden. Black and Latino people died at alarmingly higher rates than our white counterparts. So this is really, really important for us to make sure that our communities are comfortable and educated and aware and have access to this vaccine. So I'll share a few other materials with you that you all can share as well. We'll have the links. Like I said, we've got a toolkit that we can share with you all. These are some snapshots from some of the videos that we have done by medical professionals across the state. These are some of the graphics that we've created and have been shared on social media, trying to get information out to folks and trying to combat some of the misinformation that people are getting. And as I said, we do always lead people to the NJVSS system, to our COVID info hub, and then also to the call center if they have questions, to make sure that people are getting factual information. So, can't ever leave a discussion without some asks, because as we said, we need your help. We can't do this by ourselves. And as faith-based organizations, we have some support options that you can help us with. Offer community-based vaccination on your own premises. As we are developing these tools and as we're getting more resources from our federal partners at the CDC, at FEMA, and other parts of Health and Human Services, will have the opportunity to be able to host vaccination sites in community centers and in churches more frequently across the state. So we're trying to fine-tune the plans, develop all of the resources that folks will need to be able to get that done, and also make sure that we as a state can support safely having community-based vaccination sites. So as I said, you've seen we started with about 10 so far. We've got 8 of them up and running, and we're learning a lot. So when the time comes and we're able to expand those, we hope that our faith-based organizations will partner with us and serve as hosts. Another way that you can help, do pull-ins, as we're calling them. So there's a lot of folks who are having trouble finding appointments, are having difficulty accessing websites or getting onto some of our call centers. We ask that you help the folks around you, particularly younger people, helping folks that might not be as tech savvy. We definitely ask for that type of support. And as I said, help us publicize. When you hear there's an appointment open, share it with somebody. If you get some information, share it with somebody. If you hear there are walk-ins or anything like that at a nearby location, please share. Help us publicize. Help us get all of the information out there to people who need it. Every approach, every person that we can encourage to get vaccinated is extremely, extremely helpful. Also, offering awareness and education opportunities. So we have slide decks like this very one that I'm presenting to you. We can share these with you. They're part of our toolkit as well. When you all have sessions, if you have Bible study, or if you have any type of meeting, even if you're focused on something else, maybe throwing in 1 or 2 slides to help. Maybe for each session, maybe you talk about demystifying something, or you myth bust, as Nashon said, where there's a lot of myths going on. Try to break one of those. Whatever the case may be, we have the information and the tools, and we just, we ask that you help us share that information. Pull folks in, volunteer to contact people. Some places are needing help with giving people calls from their local health department to remind them about their second dose. There are a plethora of different ways to help. We've been seeing some faith-based organizations help with, like I said, registration for folks that need help registering or getting appointments. We've been seeing some folks help with getting members to their appointments. So actually, a church nearby me, they had some carpools that they were doing. So they ran their own kind of little Uber service, they were calling it, to go pick people up and bring them to their appointment, make sure that they didn't miss the appointment. So many ways that you all can help us and help the communities that you live, work, and worship in. And we hope that you will assist us in these things. So, some messages. I said, help us get the messages across. So there are sort of 5 key messages that we really want to get across to folks. And that is A, even though vaccines are here, we still need to encourage people to continue practicing the safeguarding message. Please keep social distancing. Please engage with our contact tracers when they call. Go and get tested if you need to. Always, always, always wear your mask, even after you get vaccinated. Please support eligible community members and consider getting vaccinated at an open site. For anybody who is an employer, make sure that folks have the time off from work that they need. Help people if you need to by providing them with childcare or anything of the like, just to make it easily accessible and supportive for people to go and get vaccinated. Next message is to seek out and share educational materials. Again, I keep mentioning this toolkit. I'm going to send it to Nation and he's going to get it to all of you. But please share it in all spaces that you can, be it physical spaces, anywhere that you normally might use as a channel to get some information out, emails, phone calls, hanging up posters, whatever it may be. Please do that. Provide that relevant information to the members of your organization just to help folks out. And the last one is what Nation mentioned earlier, serving as a role model. Share your experience, whether we have highlighted here a positive experience, but as Nation shared, he had some pain in his arm and somebody else experienced a little bit of dizziness. That's okay. People need to know what to expect. So be honest, be forthcoming about what your experience has been and share it with folks. They have questions about it, answer it and share as much about your experience as you're comfortable doing. And of course, a last plea for when it's your turn, when you are eligible, please, please go and get vaccinated. So thank you for your time. I'll jump back over to the comments and see if we have additional questions. And then we can have discussion, or I'll turn it back over to Nation and Damon.
So thank you, Thalia. This was very helpful, I think, and I hope that the participants agree. But there are a couple of questions. First is knowledge regarding the effectiveness of the 1-dose versus 2-dose vaccines. And so I'm assuming the difference between Johnson & Johnson effectiveness and Moderna and Pfizer effectiveness.
Yeah, so I don't have it's in our toolkit. We do have like a little side-by-side sheet that shows you all of them. So I don't want to put the figures out there, but the Moderna and the Pfizer were about, I think, 95% effective when you receive 2 doses. I don't have the Johnson & Johnson figure in front of me, but I think it was around 77 or 78%. I will, again, I promise, I'm copying and pasting all the questions into my notes so that we can go back and make sure that we answer them for you. But those are the differences. Across all 3 vaccines, though, they have all been shown to be, I think, something like 90 to 100% effective at keeping people out of the hospital and keeping people from experiencing the most severe symptoms of COVID-19, including, you're having to be on a ventilator. So those are the really key things that we see, because right now, even as much work as we're doing, New Jersey, because we're so densely populated, New Jersey still has the most cases per 100,000 residents in the country. And we still have the highest hospitalization rates per country, per capita in the country. So we're not, the governor keeps reminding us, the commissioner keeps reminding us, we are not out of the woods yet. Though we've come a long way, we still have a ways to go. So it's really important to continue to be vigilant with not just trying to get vaccinated, but also with the social distancing and your masking and all of the other protective measures.
The next question is, where can we find walk-in sites?
So I don't think there are too many walk-in sites now, and that is because the allocation of our vaccine doses is still not as high as we'd like it to be. So we have to make most sites have to make appointments so that they can make sure that they have doses available. And that's in particular with Pfizer and Moderna, because they have to defrost those on a regular basis to make sure that they have enough available for that day. That will probably change. We'll probably start to see some more walk-ins available now that we have the Johnson & Johnson vaccine.
The other important point regarding Moderna and Pfizer, since you mentioned the process of thawing them, is that there's a window of time with which they need to be used and put into arms after they've been prepped and put into vials. And so once you've done that, you have, I believe, a 6 to 8 hour period of time with which you must administer those vaccines to ensure that efficacy, that it's going to be at those levels of effectiveness that we talked about earlier. And so it's important that for scheduling purposes, that they know how many people are coming in so that they can prep those vaccines. Because they are frozen, they have to go through that process of prep and then being placed into vials and then injected. And so there's a process that we go through with those vaccines. Johnson & Johnson is more to a regular refrigeration maintenance level. And so it's easier, as Thalia has indicated, to store those and also to administer them, and not necessarily have to know that someone is coming in ahead of time in order to prep it. Any other questions? Wow, we've been phenomenal at answering all the questions. I just want to I see there's something that came in. People that have reported blood clots after receiving the vaccine, is this an actual side effect of the vaccine or a coincidence?
This one I'm not sure about. I'll have to ask that one to our epi team, our communicable disease team. They will be able to tell us a little bit more about if there have been any expansions in the list of the side effects. So we can get that back to you.
But I can say the news coverage of AstraZeneca regarding blood clotting in Europe is not here, because we don't have AstraZeneca approved in the United States. I just want to make sure that if it's about reporting of blood clotting in Europe, that is a different vaccine than the ones that are available in the United States. It never received approval here. Any other questions? As we indicated, and I know Pastor-elect Jay Smith is going to, close us out, but I do want to reiterate that we're here as your public servants, all three of us. We work as many hours as we need to. This is so important that we get this right. And it is critically important that we reach the vulnerable populations that you all serve on a daily basis. And so it's important that you know that we are here for you, that you can reach out to us. We are here to answer the questions that you may have. We do not want any perception that bureaucracy is going to stand in the way of you getting the answers that you need in order to safeguard the community. And so please feel free to reach out to us with any follow-up questions that may not have come up tonight. Also make sure that once we do send those materials forward to the district, that upon your review of the materials, if there are questions that come up, that you can always reach out to us. Again, we're your public servants. we're here at the pleasure of the administration, but we're also here at the pleasure of the residents of New Jersey to ensure that we're providing much needed public health safeguards for the residents. So with that, Pastor-elect, Mr. Smith, if you want to close us out, please. Oh, I see that. Is this a question?
No, this is actually just a thank you from our district union president, Pastor Eiley E. Bright. Appreciates the presentation, the time, the effort. Look forward to sharing with our congregation. This is valuable information for our community. And if he hadn't said that, I was certainly I echo those sentiments. Thank you, Thalia. Thank you, Damon, and thank you, Nation, for taking time out of your completely busy schedules, as you have helped us understand, to be with us as a faith community, to share with us the information that you have. All that was shared tonight was very helpful and enlightening, and we will take what we've learned and use it appropriately to help our communities, our families, our friends, our institutions, where we work, where we play, socially distanced, and you following proper guidelines. But we're going to take this information and use it to glorify God, number one, and help our communities be safe and protected. So again, just many thanks to you all for this much needed conversation and this engagement. I don't know if there's any parting words or closing comments that you have, maybe providing just your information if follow-up is needed, that may be helpful.
Sure. So I'll ask if Damon or Thalia have any closing remarks before I end the discussion.
I guess I'll just say again, thank you for having me. Thank you for listening. Thank you for engaging. We really, really appreciate it. And if you have other suggestions, if there are other community events or standing virtual meetings or town halls or anything like that you recommend we join to spread the word a little bit more, please let us know. People just send us messages and they're like, we're having something here, can you get on? And we're like, yes, send us the time, we are ready to go, because we need people to get vaccinated. Everybody is tired of COVID. So yes. This is a really important step for us all, and we want to be sure that people are comfortable. As I said, please be patient with people. We're all in public health, so we are like, yes, vaccine, give it to me, let's go. Everybody is not that quick, not that comfortable. So be patient with folks, help them along through their journey, and also be ready to accept if somebody just not willing to change their mind. But try to get them to protect themselves however they can and make sure that they have accurate information. And we're going to get through this together. So thank you again for having me.
Thank you, Thalia. I really appreciate you jumping in, especially since you jumped in at the last minute today. What you all don't know is that that another colleague was going to join us, but had a scheduling conflict because, as Thalia indicated, we are asked to join so many different meetings, and that colleague and another colleague, two other colleagues, were asked to join other efforts. And so we're trying to make sure that we spread the love and spread the service. And so she joined at the last minute. And thank you so much, Thalia, for your contributions to this discussion this evening. Damon.
Same as Thalia. Thank you, everybody. Appreciate the time to share what we do and how we can help you and how you can help yourselves, and that this is a partnership. And as I mentioned, we are more than happy to talk further about bringing vaccines and bringing testing to your churches, to your communities. We need to hear from you, though. Right. We reach out to those that we know of that have already touched base, and we're making those connections the best we can. We know there's a lot more that can be made and should be made. it helps if you make that first call. If you reach out, we will figure out how to bring what you need to you the best we're able to. I mean, I certainly can't guarantee it. Testing is a lot easier. We have different vendors, and I can make that happen. Right. That's part of, that's the main part of my life right now is, so I can absolutely make that happen. The vaccine, we do have a limited supply. So I do everything I can to make that happen. But please reach out. We're happy to see what we can do to support, your congregations and your communities.
I
Thank
can
you so much.
attest to Damon. He's been up and down the state for the last few months, bringing test kits all over Tarnation.
Yes.
So he means it when he says he'll get it
He
to
does.
you, even if he has
Yes.
to drive it himself.
We make it happen. We make it happen.
This is very much true. And so, Damon, again, thank you. I can't tell you how much I appreciate, as your assistant commissioner, all of the things that you do that are well beyond your job title and your responsibilities. But it is evidence of your passion and your service to the residents that you do it. The one thing that I'll say as I close out is that I had a candid conversation with a family member today, and the family member said to me that they're not getting vaccinated and that they're going to wait it out and they're going to wait for herd immunity. And I shared with that family member that I was concerned about that posture. I said, I just want you to be clear what herd immunity means. Herd immunity does not mean that the virus has been tamped down to the degree that it can't be transmitted. It does not mean that it has been eradicated. What it means is that your risk, your probability is reduced. But it does not mean that your probability is zero. It just means that it's a lower number. And what I'm concerned about in our community is if there are those who express that they are going to wait it out and that herd immunity is going to be their backup plan, it's not an effective plan. So I want to ensure that as we talk with one another, that we talk with background of what is based in fact and what is based in science. Now, this family member, she heard, I think, for the first time that very clearly. And I don't know if she's going to change her mind, but she did say, wow, okay, I didn't think about that. But I really think that part of these discussions, these candid conversations, are how we get there. And so I want to thank the district union for asking me to come out. When Pastor-elect Jay asked me to do this, I said, absolutely. And it's important because it's through these conversations that we change hearts and change minds, and that we safeguard our community. And it is our community that's being hit hardest. And so I want to thank you all for giving us opportunity. Yes, we gave of our time, but this is what we do in public health. And so we thank you for giving us the opportunity and the platform to be able to share with you this evening.
I just want to quickly remind everyone who's watching that this broadcast, if you will continue to be on the district union's Facebook page as well as their YouTube channel. And if you're watching right now, I would advise that you would share it with your community. Part of having candid conversations is the connections that we have with each other. And so if I tell you, then you tell someone else and they tell someone else, and then we can share the information and it grows exponentially. And so we reach more people than we can even imagine. And so that's very important for us to do at this moment in time, is to provide clear, concise information that can be used to make a responsible decision. As Nashon said before, information and making an informed decision is the key. And again, we give people space to do that. I mean, I wouldn't be a preacher or pastor if I didn't, share the gospel in this moment to say that that's exactly what we do as Christians is we have these candid conversations and find out that there really is no plan B, that you only have one plan in place, and that's through Jesus Christ. And so it's again connection. We are connected to this one God, this eternal, this sovereign God. And so again, thank you, Nation. Thank you, Damon. Thank you, Thalia, for taking time out to do this with us. I'm just going to give a quick word of prayer to close us out and just thank you again, and we'll be done. Is that okay?
That's fine. Thank you.
All right. Let us pray. Gracious and heavenly God, our Father, we thank you, we praise you, we honor you, we glorify you for allowing us to have this discussion tonight. God, thank you for your presence. Thank you for the panelists, the guests who came and provided such rich information for us to consider. We pray, God, that we would be attuned to your spirit, that you would speak to our hearts and our minds concerning COVID-19 vaccination, and that we will follow your will, that we would follow your heeding. And God, we ask that you would just cover each person watching tonight, bless homes, bless families, bless communities. God, we pray that we would continue to walk after you in your will and do it your way. We pray, Father, for our district union, pray for our president, pray for our member churches. Pray, God, for all of humanity, that you would continue to rest, rule, and abide within each of us, God. And may your will be done on earth as it is in heaven. Pray this in the strong and the mighty name of Jesus, who is truly and certainly the Christ. Amen.
Amen.
Amen. God bless you all. Thank you so much. And take care.
Thank you. Bye, all.